Hello and welcome to EJC News Focus. Myelodysplastic syndrome covers a range of cancers that lead to a drop in the numbers of healthy blood cells. Outcomes are often poor, but at the European Cancer Congress in Vienna, Guillermo García Monero from Houston presented new lines of research. He told me that the implications of the research go well beyond this particular disease.
So myelodysplastic syndrome refers to a group of leukemias that are extremely heterogeneous, and they can be confusing. Around 10-15 years ago, still many doctors thought that this was kind of like a pre-leukemia that then evolved into full-blown acute myelogenous leukemia. Now we know very well that this is a distinct type of leukemia. We know that because this disease is what we call clonal, so it comes from an ancestor cell. Clinically, this disease is characterized by low counts in your blood. We call that ineffective hematopoiesis or cytopenias, risk of infections, and then this increased rate of transformation to acute leukemia. It affects older people more frequently. But now in this meeting you saw so many advances in terms of solid tumors. There's a group of patients with what we call secondary MDS that are patients that had either chemotherapy or radiation for whatever solid tumors they have, that they go on to develop this type of high-risk secondary myelodysplastic syndrome.
Why do you call it an epigenetic disease? Sometimes
I wonder if the biology drives disease or drugs drive the disease, because in general, all cancers have an epigenetic component, so we know that. Indeed, actually, if you look at these alterations, these epigenetic alterations in melanoma versus lung cancer versus leukemia, they're probably not very different. But what is unusual in myelodysplastic syndrome is that this is the only disease where these drugs that we call hypomethylating agents, like azacitidine or decitabine, have had very significant clinical activity. So that's the question. The question is that colon cancer probably has as much methylation as MDS or AML, but azacitidine and decitabine have no activity. In contrast, in MDS and AML, these drugs are effective. And that's the question. The question is not why they are epigenetic. In reality, the question is why are they more sensitive to these epigenetic regulators?
Do you know why?
No, that's like the billion-dollar question. If we know, you know why that will be very important is that then you could get that knowledge and export it to solid tumors and figure out why they are resistant.
How far has this increased understanding driven clinical progress?
What it has done actually is that it has propelled this to a level of research that we couldn't even think before. Because then people started thinking, how do they work? Are there patients that have more or less methylation where these drugs can work better? The doctor asked in the meeting, is there a particular mutation that may be more susceptible to the effect of this drug? So this actually has pushed us as investigators to go deeper and deeper in the understanding of this disease.
So what's the link between methylation and cellular immunity?
I said that these drugs, like azacitidine and decitabine, are effective, but they are really suboptimal. You know, we have responses in 30-40% of the patients. They improve survival, but patients eventually will lose response to these agents. And as I showed in the talk, the survival of these patients is very poor once you actually stop benefiting from these compounds. So from the beginning, actually, we've been working towards new combinations. So we thought about perhaps second-generation hypomethylating agents. We discussed in the meeting combining this with these histone deacetylase inhibitors or HDAC inhibitors. In the test tube in the lab, this was very promising, it was very exciting, but it didn't really work out clinically so far. But by serendipity, we actually have now, over the last couple of years, identified that these hypomethylating agents actually trigger both cellular pathways like this PD-1, PD-L1. I'm pretty sure you have interviewed multiple people during this meeting because this pathway is very important for multiple solid tumors. And they also trigger a pathway that we call innate immunity. But this innate immunity, interestingly, we see it in the stem cell of this disease. This is very important because now this allows us actually to perhaps develop new combinations. So we're working very hard on combinations of azacitidine with inhibitors of this PD-1, PD-L1 pathway. And this actually allows us to perform hypotheses in terms of what will be the proper sequence of this type of combinations. And then we are less advanced with targeting innate immunity. Innate immunity are primitive systems that the body has to fight infections or some type of aggression from the outside. But for instance, there's this number of molecules that we call toll-like receptors. And we're working on inhibiting this pathway, particularly with an inhibitor of toll-like receptor 2, to see actually if by themselves or in combination with these hypomethylating agents, we can actually understand or develop better type of approaches. But I think the key for this, in this particular disease, is going to be to understand actually what is the stem cell compartment that we are attacking, because as opposed to melanoma or lung cancer, where you have multiple clones, but they are out here, you're actually talking about different layers of blood-forming cells that may be disruptive one way or another, and how these combinations actually attack these very primitive clones may actually be what actually ends curing this disease. So I think this is something that we were not really expecting per se, like in terms of combinations, but this is right now the most active area of combination. We have easy 10 trials at home doing ASA with PD-1, PD-L1 combinations, etc. So hopefully this will be the next step for us, because we're in need of new drugs for our patients.
There's at least some hope then for these patients. And with thanks to Guillermo García Manero, that's it for this month's EJC News Focus.